Hi there, my name is Dr. Monique Ruberu and I'm an OBGYN physician, and I wanted to talk to you about something that really affects so many women all over the world. Have you ever noticed that right before your period, in those few days or that week right before, you start to feel a little bit irritable, a little bit angry, a little bit more impatient? You might want to get away from other people. You might want to be all by yourself. Maybe you experience more breast tenderness, sadness, depression, anxiety. Maybe your bowel movements change. Maybe you even have swollen ankles. You might have PMS. So what is PMS? PMS is premenstrual syndrome. When people have this really badly, it's also called PMDD. And PMDD is just a more significant, stronger version of these same symptoms. So if you're experiencing this, typically a gynecologist would try and treat you by giving you birth control pills to shut down your cycle, or they would offer you things like Zoloft or anti-anxiety or anti-depression medication. But instead, at Natural Women's Health, we like to do things in a very natural way. So what we'd like to do is to help you understand why is this happening. In order to do that, we would get you to chart your cycles, your bleeding patterns, your mucus patterns, so we could figure out what's going on every day in your cycle. That way we'd be able to figure out when you're ovulating, when you're not ovulating, and that will give us information that we can use to check labs throughout your cycle. We can look at what are your estrogen numbers before you ovulate, what is estrogen and progesterone after ovulation. Oftentimes when we look at these numbers, what we find is that people that have bad PMS tend to have lower levels of progesterone. When we look at those labs and we look at your charting, oftentimes we'll also see that people with PMS have a lot of tail end brown bleeding, they have really short cycles, the time between ovulation and their next period tends to be shorter. All of these are really obvious signs that your PMS symptoms is likely due to a lack of progesterone. Sometimes it's also due to a lack of estrogen, but the only way that we would know that is if we check labs throughout your cycle and have a really great understanding of why you're experiencing these symptoms. Once we figure it out, the solution is really awesome. We can give you compounded progesterone that's derived from yams. We could give you natural seeds that replace the lack of progesterone or estrogen during your cycle. All wonderful options that are completely natural, wouldn't cause an increased risk of cancer or any other issues, and oftentimes will leave you in a much better place. So, if every month right before your period you feel like scratching your husband's eyes out, or the sound of your kids' voices is like fingernails along a chalkboard, then check out naturalwomenshealth.com. Come and see our website and come and check out our treatments for PMS. Send us a message through the portal and we would be happy to help you. Thanks so much. Have a wonderful day. God bless. Bye-bye.